Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast that I call the Common Sense MD. You know, a lot of times people ask me what I do personally. So today I thought I would just go over everything that I do to stay healthy. I'm almost 70 years old and I want to stay healthy past 100, maybe longer. People are living longer and healthier. So I want that health span to be long and enjoyable. So, and most of my patients are really baby boomer age. So that's kind of my demographic because I'm right in the middle of it. So, I'm going to do this podcast on everything that I do personally. You know, and I realize that I'm in longevity business. I study it, I practice it, I preach it, and so, but I do a lot of things, so don't think you have to take every supplement that I do. But again, I always tell people I'm not going to do anything to my patients that I'm not willing to do myself. So it's safe. But at the end of this podcast, I'm going to tell you my list of personal supplements. But anyway, so what do I do for longevity and overall health? I always have based my whole practice on 4 things you really need to focus on. The first one's nutrition. The second one's exercise. The third one is sleep. And stress is in there too, handling stress. And the fourth one is, of course, hormones, which is my expertise that I've taken a deep dive in through many years. As a lot of doctors just don't know a lot about hormone replacement and workup. I work. You know, I'm basically 70 years old. I'm not going to retire. I think that helps me overall with everything, including my brain, because I want to avoid the downgrading of my brain. I want to keep sharp. So I'm not going to retire, but I do take time off. I finally learned to do that, so I don't work quite as hard as I used to. I've learned to delegate. I think that's important. But I have routines, and I biohack with supplements, which I'm going to go over in a minute. And I try to keep a positive attitude on things. You know, I think that goes a long way with healthy aging, is just your attitude. I learned to say no. You know, I don't worry too much like I used to with what people think. I think that's really important. I can relax. I learned to relax. You know, my whole life has been working, and finally get to a point where you realize you need to learn to relax as much as you do need to work. I'm curious about learning new things. I think that helps your brain a lot. And mostly, for me, it's in the field of medicine because that's my business. I try to think outside the box, be creative, really, and that's what's made me successful in this kind of medical practice, is thinking outside the box, having an open mind. And I love to connect to my patients and my friends. That's a big thing. Somebody asked me the other day, what do you enjoy most about being a doctor? It's really connecting with patients and helping them out in any way I can. A lot of times that's with their physical being. A lot of times it's psychological. If you're a family doc for 40 years, you learn that half of what comes into your office is psychologically based, or you can help them in that way. So I like to connect with my patients. So I enjoy my life and don't worry like I used to. You know, with age brings wisdom. I always tell people that. In medicine, I think really common sense and experience are paramount to being a physician. There's no doubt about it. You need to know what to be concerned about and what not to be concerned about as a patient. You know, I have patients at both ends of the spectrum. Some patients over-worry about everything. You know, they get over-treated and over-tested. They go everywhere. And as I've gotten older, I'm more honest with people, you know, and I'm not afraid to be direct with them sometimes because I think it helps them. Some take my advice, some may not. So occasionally I'll see a patient and as one of my good psychology buddies says, the only thing wrong with you is that you think something's wrong with you. So for some patients, that's true. It's a minority. And on the other end of the spectrum, there's some people that just, especially men, that just don't get screening, and they're too macho. They don't believe that they need screening tests when you really do, because you want to catch something early if you've got something going on there. Pay attention to how you feel. So there's always a happy medium to it. But so here's what I do personally. And remember, everybody's different. Everybody's gut microbiome's different. Everybody has different genetics. But as you age, there are certain commonalities that are appropriate, and a lot of people have common things. And if you've practiced as long as I have, you've seen a lot of things. Not everything, but a ton of stuff. And I'm certainly not perfect in what I do. I get off track with my routines, but I recognize that and get back on track. And always remember to enjoy life. Don't get so bogged down with every little biohack that you're miserable and you're afraid to go out and eat a piece of birthday cake with somebody. So here's the nitty-gritty of my personal health and longevity protocols. I do get 2 Cleveland heart panels a year. Most people probably just need 1, but I'm on Medicare. My Medicare pays for it twice, so I'll look at things and see where I'm at. I also like to get the in-body scan a couple times a year to see my body fat percentage, my visceral fat, how much muscle I'm gaining, hopefully, rather than losing at my age. So I do that a couple times a year. My diet, low carb for me. Again, when you raise 2 diabetic children your whole life, you look at carbs. So for me, it's more of a low carb, high protein, and high good fat diet. I eat 2 meals a day, so I do intermittent fasting. I no longer eat breakfast. I feel way better because I don't. Some people do better with breakfast, so I'm not strict on that. And I do very little snacking like I used to. I definitely don't eat at night. And I consider my vitamins and supplements, which I'm going to get to in a minute, a big part of nutrition. It's just part of my nutritional pattern. They're supplements. There's just no way of getting around it. You need them. I exercise daily. I do a 30-minute morning routine. The first thing I do, of course, is go out and outside, unless it's just terrible weather. Even the cold, I go outside and look near the sun to waken up my retina and my brain. I think that's very important. So then I do a 30-minute routine. I do lots of band work, resistance training. I do push-ups, pull-ups. I stretch a lot. I try to work every muscle daily, and I don't do heavy stuff anymore. But I strive to build muscle. As you age, you lose muscle. You need to build it. And I pay attention to my supplements, of course, my muscle building supplements, which I'll list in a minute. And of course, I take testosterone. I mean, you don't get this age and have a great testosterone level. Very few do. Some do, but most don't. So I take that, of course. After work, or maybe if I'm off, I do some fun exercises. I love to ride bikes, and I love to play pickleball. Keeps your brain sharp, just keeping the score. And I walk a ton, especially upstairs. So I walk a lot. I really try to get a good night's sleep. That's a hard one for most people my age is a good night's sleep. Every one of my patients comes to me, I'm not sleeping like I used to. Well, you're not going to, and you need to biohack your way and measure it. But I did notice, if you've seen my podcast, that I do have sleep apnea. I think most adults do. You don't have to be obese or have a thick neck to have sleep apnea. So actually my Aura ring, which I couldn't do without, clued me into this because it takes your O2 sats at night and your breathing regularity. So that's kind of what clued me off about that. And then I got a home sleep test, and sure enough, I was having 32 events per hour. Even somebody as skinny as me, I use a CPAP machine. And it really has helped me. I always tell people to sweat. I use my infrared sauna with red lights. Connect with people, and no tech. Sweat, connect, no tech. That's not original, but I think it's a good thing to go by. So for a period during the day, I'm not near my phone or any kind of electronic devices. I think that helps you. Be curious, and be bored at times. You need to go through a time when you're kind of bored. Boredom spurs creativity. So it's okay to be bored. With this high-tech world, with everything coming in, you need to be bored part of the time. So just get away, preferably in nature. Walk around in the woods. I love that. It really recharges my energy to be in the woods. And don't compare yourself to other people. That's a big mistake. I've done that in the past, and I'm my own person. I don't compare myself to anybody. And so many people do, though. So please don't do this. Stress. I have a lot of relaxation times. I've learned how to relax as I've gotten older. I've always been kind of a guy that's tried to achieve things, and I've learned that just being able to relax is a gift, and I've had to work on this. So I set aside a quiet time for what I call maybe meditation. I consider it meditation. And I don't let people stress me out like I used to. I have faith that everything's going to be fine. I try not to worry too much. If you have faith, you don't worry as much as you used to. But like I said, the positive attitude is very important to me. Hormones, they're all important, and not just testosterone and estrogen, but cortisol, insulin, thyroid. My thyroid is normal but suboptimal. So when I measure my body temperature, it was low. So I take a small dose of NP thyroid. It's really helped me. Vitamin D is a hormone. And of course, testosterone, which I'll always take. There's so many misconceptions about hormones. You need to do it right and monitor it. And ladies, perimenopause and menopause ages, please consider bioidentical hormone replacement therapy. It's my firm belief for a couple things. Testosterone does not cause prostate cancer or any prostate problems. It does not cause heart problems or blood clots. Same for women. Bioidentical estrogens do not cause breast cancer. And same thing with women need progesterone, testosterone, and DHEA. They do not cause breast cancer or any type of cancer. In fact, they lower your risk. Look at all the recent studies on this. A whole generation of women has been misled about this and missed out. But it's never too late. So check your hormones and don't be afraid to replace them. Be afraid not to replace them. But you need to do it right. You need to get your screenings, of course, like your mammograms, the thermograms, your colon screenings, prostate screenings. So do that right. So here's my list of things that I do. And again, don't think you have to take every supplement that I do. This may blow your mind how many things I take. But again, I've learned to put a lot in combination. That's why I contracted Friedman to formulate in Oregon to get these combination vitamins that I have made to my specifics, and they have no fillers in them. So I'm very big on taking good quality vitamins. It's very, very important. So, like I said, when I get up in the morning, I go outside and look near the sun. I don't stare directly at the sun, but it's good for your retina. It wakes you up. I also drink some Life Boost coffee. It's organic. It's low acid. And I put D-ribose and a little keto collagen in there with it. Then I drink out of my bottle of hydrogen water that I ionize it. It's supposed to give you energy, and has an extra hydrogen atom in there, and it's really makes you better hydrated. So I do that, and I add a little bit of lemon ginger organic juice in there every morning. It's supposed to kind of help your stomach, and it's got good vitamin C in there, and I think I've done that for years. So I do that in the morning. Also, sometime during the day, I eat raw, unfiltered, local honey. I think that really helps my health and prevents a lot of things. I tend to get allergies in the fall. When I do that, I just don't get sick, knock on wood, and have allergies. So that's kind of my morning routine. My supplements include my Super Multivitamin. And it's a combination vitamin that's really all-inclusive. It's potent. Always take it with food, but it includes 5,000 of D with K2. K2 meaning MK7, 180 milligrams. I take a gram of highly absorbable vitamin C. It's got vitamin A. It's got all the methylated B complex, iodine, zinc, copper, selenium, manganese, chromium, potassium, boron, lycopene, horsetail, and the natural form of vitamin E. So that's all. I get all that with the Super Multi. I take a good form of omega-3s. I think that's very, very important. I take a supplement. It's a peptide, BPC 157. It's great for your gut. It's great for healing. It's one of the most important peptides, I think. And again, if you have questions or things you need to learn about these various supplements, just go look it up in podcasts I've done in the past about why you need to take omega-3s or vitamin D or peptides as well. I take Digest Shield for my gut. That's the best gut pill I've ever seen or recommended because it includes about everything you need for your gut. 99.9% of my patients, when I put them on this, they say their gut is better, especially people that have IBS or any kind of gut dysfunction. I take an energy complex in the morning, which has CoQ10, PQQ, and taurine in it. I take pregnenolone, which is a precursor hormone, 100 milligrams. I take quercetin max, which has NAC, N-A-C, in it. I take DHEA, 25 milligram. Women take 15. I take my pain formula. I have a degenerative disc disease in my lower back. As I get older, that's really the main pain I have is arthritis in my lower back and degeneration. The pain formula has turmeric, black pepper, MSM, bromelain, boswellia, and paractin, which is my secret ingredient in that. But it really helps me. People really love this pain formula. So if you're older like me and you have chronic little arthritis, chronic pain, think about that pain formula. I have a stress relief vitamin that I use not all the time, but when I need it. It includes ashwagandha, L-theanine, and saffron. That's a really good combination. And I also have a workout cocktail that I take, which includes advanced aminos, the essential amino acids powder. I take my creatine powder with HMB, hydroxymethylbutyrate. Those are both muscle builders. And I also put methylene blue in there. Methylene blue is great for your brain. It just delivers oxygen to your cells. And methylene blue is a great hidden secret. Look at my podcast on methylene blue. It's an amazing thing. At night, of course, I take melatonin. And not only for sleep, it has other vast benefits. It's very anti-cancer. I take my anti-aging formula at night, which includes astragalus, NR, which is nicotinamide riboside, resveratrol, and apigenin. That's a good little combination. That's my anti-aging formula. People like it. I take 25 milligram of progesterone. Men that take testosterone can take progesterone to balance out their estrogen levels. That's something you have to check. Make sure you're not aromatizing too much to estrogen. So I take a little bit of progesterone. Also helps you sleep. Of course, I take aspirin. Look at my podcast on aspirin and how important that is, not only for preventing cardiovascular disease and blood clots, but also it's very anti-cancer, especially GI cancers. I take Gamma E at night, which is mixed tocopherols and tocotrienols. That makes the progesterone be more absorbed, for one thing. So women that out there taking progesterone at night, think about taking Gamma E. I take full body magnesium, helps you sleep, prevents cardiac arrhythmias, helps your gut. There's a lot of different types of magnesium. Go to my podcast on magnesium, but the one I chose to make and take is magnesium glycinate, threonate, and malate, all in the same pill. Once a week, I take rapamycin, probably the ultimate anti-aging drug there is out there. Go to my podcast on rapamycin. Or go to Dr. Atia's or Sinclair's podcast on it. Rapamycin I've been taking. I love it. So I also, like I said, I take a small dose of NP thyroid, but that's in the morning on an empty stomach. I take 5 milligrams of tadalafil daily. That's just not an ED drug. It's great for your prostate. As you get older as a man, you're probably going to have some prostate problems, so I take that. It's also great for your blood pressure. It's a releaser of nitric oxide. 5 milligrams of tadalafil has multiple uses. So that's basically my regimen. I may take a few other things that I didn't mention here. I take a lot of stuff, and I'll have it, of course, printed out here. A lot of what you take depends on how old you are. But I also think that everybody ought to have a travel medical kit. I tell my patients all the time, I'll be glad to write them for this or supply it. Of course, I would take a Z-Pack with me when you travel. I would take ivermectin with me, which is another thing a lot of people take a couple times a week, just prevention, and a lot of benefits by that drug. I take Zofran, I take Imodium with me, I take activated charcoal, I'll take a Medrol dose pack. So you need to be prepared. So those are some of the things you probably need in your medical kit at home. I tend to trust my patients and educate my patients on things they need to be prepared for. So I know that's a lot of stuff. Look at my list that I take. I've been taking them for a long time, and I continue to study longevity supplements and drugs. So keep up. I'll try to keep you up. I hope you enjoyed this podcast. I'll see you next week.